This is the Beyond the Prophy podcast, the podcast that empowers you and inspires you to seek career excellence while pursuing your passion. And I'm your host, Jasmine Haley. Hey BTP family, this Beyond the Prophy podcast episode is brought to you in part through a sponsorship from Young Dental. This episode's featured product is the Delish 5% sodium fluoride varnish. It's smooth and translucent. There's no stringiness or clumping that makes it difficult when you're trying to provide a fluoride varnish treatment. It comes in 4 delicious flavors: vanilla cupcake, green apple, fresh melon, and spearmint surprise. It's gluten-free and it's pre-mixed. And I absolutely love the green apple flavor. My children and I tried it for the first time last year and we absolutely loved it. It's kid approved. To find out more about this product, visit them at www.youngdental.com. Enjoy the show. Welcome to the Beyond the Prophy podcast. I'm very happy to have this guest who I virtually met through Instagram. Instagram is amazing for seeing new and upcoming and just amazing professionals who are just rocking it. And my guest today, Krystal Savice, is one of them. And I'm very excited to introduce her to you all. So welcome, Krystal, to the podcast.
Thank you. Welcome, everybody.
Yeah. Hello. Oh my goodness. So Krystal is a friend in my head because we haven't met virtually, but I knew that we had like a connection when I saw her getting down and singing right before or during studying or something like that. Like I normally either break out to some sort of Beyonce or whatever craziness that I would never do in public around other professionals. Anything to keep the hours going,
Yeah.
It's crazy. But you had the courage to show that, and I love that.
Thank you. It's like raw footage because it's like every day, really. Like it just happens. Like I don't plan it. I try to do I'll tell myself 2 hours of studying, and then I can listen to some music. But I just start singing something in my head, and then I'm like, let me just play the song and let me start dancing, and then. But it helps the study session go by much faster, much smoother.
Yes, absolutely. Absolutely. So why I wanted to have her on this podcast is, one, she has an amazing Instagram feed. I see the work that she's been putting in. And also she has a very unique perspective that I feel many hygienists are inquisitive about it, especially when hygienists decide to leave the profession and go into another health profession. So what makes Krystal very unique is that she's currently in her first year of medical school. And she has the dummies to prove it. On her Instagram feed, she shows some of the stages that she's going through. And I definitely want to dive deep into that right away. Because when you look on the forums, and of course you've probably seen them, people are like, well, should I go into nursing? Or has anyone done physician's assistant? Or what else have I seen? I think physician assistant and nursing is one of the top ones that I see for dental hygienists. So what made you transition and go into medicine?
Okay, so my journey actually started with dentistry, and I had braces in middle school, and I was obviously always in the dental office every month. So after that, I was like, oh my gosh, I think I want to become a dentist. So that was my course. So I applied to colleges, and I wanted to become a dentist, but I also wanted to have a backup in the case that I didn't get into dental school or if I changed my mind. But I knew that I wanted to be in dentistry. So I majored in dental hygiene, but I was also taking my prerequisites for dental school. And so I ended up graduating a year earlier with my bachelor's. And within that time, I kind of like crammed my dental admissions test. So I took that the dental admissions test, and I scored like pretty okay, but I only applied to like these top tier schools, not knowing that like, I mean, an okay score is fine, but like you need to have your safety schools that you should apply to. But I just assumed because I had like this dental hygiene degree that I'm like, oh, they're gonna be like, oh, okay, like let's just let her in. Anyway, so that didn't happen, and I had graduated with my hygiene degree, and anyway, I started working as a dental hygienist, and my goal was to study for my dental admissions test again, and apply again to dental school. But as I was working as a dental hygienist, I started to realize that I actually loved dental hygiene more than what the dentists were doing in my office. Mm-hmm. And I just loved the preventative aspect. And I felt like I could actually like contribute to my patients' oral health and like their systemic health more as a hygienist than being a dentist. And I really just love seeing like a lot of my perio patients go from like moderate to severe gum disease to and just go from a patient who just like never flossed or never brushed to a patient that became aware of their oral health and just became more like in tune with what they need to do. And I just love that aspect of it. And I would even just like correlate things in their chart. If a patient had a lot of like decalcifications or a lot of cavities, I try to see like maybe there's some like nutritional deficiency. And I got like really, really involved with like making these connections. And so I basically started to feel like I wanted to do more beyond the realm of the oral cavity. But I also wanted to have like a profession where I could be this like kind of holistic person. And so I started looking up medicine, and I saw that there was like osteopathic medicine, and I saw that they do the same thing as an MD doctor. They all do the same thing, but there's an extra component that is more holistic. And so I started looking into those schools, and then I just had this epiphany one day that I just didn't want to do dentistry anymore, and I actually wanted to go into medicine. And from there, I took my MCAT, and now I'm here.
Wow. Wow. Okay, so that's interesting. So when you decided to go into medicine, did you like have to retake any prerequisites, or did you being a dental hygienist help with you getting into medical school, especially with the DO option instead of the MD?
Well, in order to apply to dental school, like the prerequisites for dental school and medical school are pretty similar. They're actually like the same for most schools. They're pretty the same. They're the same for most schools, but it's just that instead of the dental admissions test, I have to take the medical school admissions test. So I had to do that one. And then I also took an additional class, which was biochemistry, because a lot of the med schools started having this requirement. So I did that while I was working as a dental hygienist also. But I'm sorry, what was the last question?
I don't know.
Okay.
So we're just gonna enjoy the conversation because I've already got another follow-up. So like, when you are a hygienist and you go into dental hygiene school and you go in there and you say, oh, I want to be a dentist, or I want to do this, people like, ugh, like this is not a stepping stone to anything else. That's the conversation that you normally hear. Did you feel like any doubts about transitioning into medicine or advancing in that way and leaving dental hygiene? Did you ever feel like, I don't know about doing this? Did you ever encounter any of that?
Yeah, I definitely, like, even when I was in dental hygiene school, my advisor was actually she wasn't really that helpful. And I think because I told her that there was a few girls in the program that wanted to become dentists also. But when I told her, she told me that I could take my prerequisites at community colleges. And I was like, I don't think so. I mean, you can, some people do start off in community colleges, but if you're already at a 4-year college, like it looks bad on your application if you go to a community college, because some people do that so that they can get a better grade in classes. But I was already going to a 4-year college. So that was kind of weird. But she would always ask me, like, are you sure? Do you know if you can do it? But I was doing really well in my classes and everything. So I think, I don't know, she just felt like it was something that I couldn't accomplish. I don't know. But that was like the first step. But obviously I knew that dental school would be rigorous. And then making my transition from dental hygiene, a lot of people did feel like I only knew about the mouth, and that's just like a small part of the body. That's not really that important. But actually doing dental hygiene and like a lot of stuff that I learned in hygiene school was actually really helpful for like doing well in my classes in medical school. Because we learned, like, yes, we did learn about the mouth more, but we did also have like a general science knowledge. So some people did doubt me when I would like shadow at some doctor's office. They're like, why don't you just become a dentist? Like, why are you coming to medical school? Like some of the reasons why they would say that would be because I guess I would say half of the time they would say that just because they felt like I was, just doing something beyond my, like doing something beyond my reach, like something that I probably couldn't accomplish. And then also they would just be like, dentists are always on vacation. Like they have a much better quality of life than us. They're like, don't you want to be on vacation all the time? And I'm just like, and I actually said, I was like, no, I want to do something that's fulfilling. And they're like, really? And I was like, are you a doctor?
That is so interesting that they have that perception of dentists when dentists they work really hard.
Yeah, their perception is that dentists are always on vacation.
That is so crazy.
Yeah.
So crazy. I mean, they don't have the hours of working late at night.
Yeah.
They have the regular work hours, but I mean, wow, that's pretty interesting. So what is medical school like? I mean, obviously we already know that, dental hygiene school is a boot camp. So what is medical school like?
Medical school is, okay. So medical school is really good in the fact that you're kind of like the captain of your ship. So they give you the tools, and like a lot of our lectures are online, so we watch them at home, but we do have to come in weekly and do these mandatory quizzes, which are open book, and it's like a shared discussion amongst our classmates.
Wow.
And it's called clickers. So we have like a clicker that's like a remote control, and we'll type in our answer based on the multiple choice options. So the clicker session is meant to kind of just like help us reinforce that material that we learned at home, since we're not having like in-class lectures. And that's the opportunity that we get to ask the professors anything that any problems, or just like clarify things that we didn't understand in lecture. But I do like the fact that although there's lectures, but it's up to you to like decide how you want to learn your knowledge. Like you don't have to use the lectures. Like you should use the lectures, but there's also PowerPoints. Like for me, I love to read, and I really don't like to watch certain professors, because if I don't feel like I'm getting a lot of knowledge from them, I'd rather get it from the book, because I like a complete story. And I just like to be more efficient. So I just feel like I'm kind of just in control of my ship, where I can just like read the book on my own time. I don't have to watch the lectures. When I'm done, I'll just like go through the slides. But you just have to like do your own like time management and find out what works for you. So that's like the hardest part of medical school, just finding out your study schedule, because the way you studied in like high school or college is definitely not going to be the way you study in med school, because we have like 20 hours of lectures a week. And then we have to come in for clickers. And then we also have labs that we have to come into. So, and then we still have to somehow maintain, extracurricular activities so that we're like active in community and active on campus. So it's all about like seeing what works for you. But I just like figured out my sleeping schedule, and I go to sleep. Yeah, like, I go to sleep much earlier now. And I wake up much earlier because I used to like try to stay up until like 2 or 3 in the morning and study, but I would wake up late and I'd feel like really groggy. And I used to do that when I was in college, and I can't do that anymore. I can't.
Wow. Wow. So it's almost like a flipped classroom.
Yeah, basically.
Whereas dental hygiene, there's like, I know that I only know one university that I think the entire program is flipped, and that's Ohio. I think it's Ohio State, somewhere in the Midwest area. So, they'll get their lecture at home at their own time, and they come in, and it's enhanced learning because you're responsible for learning the content beforehand, and then you're applying it as a class. And I've always wanted to teach that way. I've never had the opportunity to do that yet, but I love the fact. And I think in general, medicine in general is a lot more further and advanced in some things that I've seen. For me, my area of expertise is working with persons living with HIV, dealing with substance abuse. So I've seen the advancements in medicine by going to their conferences, going to the nurse conferences, and dentistry is still here. It's back here. It's not really catching up to so many of the other things that we see happening in other health professions. Which is sad. I'm hoping that that'll change over time.
Yeah, because when I went to NYU for undergrad, and it was only our anatomy class that actually had like the flipped classroom. Like we had an actual lecture, but they started this thing they would call it podcast, but it was like a video, basically a video lecture. And then we could like interact with it from home or something like that. But it was like the first year that they had started out, and it was only for anatomy class. But that was like pretty cool because I'm a person that doesn't really like to go to class if I don't have to.
You're one of those students, okay?
Yes, but like my friends are like, Krystal never goes to class, and then she just shows up and like aces the test. I'm like, I don't know. I don't really learn that well from like sitting there. Like I love to like read the book, and then I don't know.
You're not really an auditory learner.
Yeah, so it like
that's okay.
It's just now class is like mandatory because the clickers are 10% of each class, so I have to show up. But if I didn't have to, they wouldn't see me.
It's so funny. One of the first ladies that was my mentor when I started educating, she said the same thing. She was either not in class or sleeping. And that's all her. And she passed everything. She passed. She did well. She was like her class, her dental hygiene class. She was first dental hygiene class that graduated from the school I was teaching at.
Oh wow!
And she was like that all they knew of her was that all she did was sleep.
Oh my god!
So some people are like that, some people are definitely like that. And that is a blessing. I won't, I have to keep that in mind too, because as an educator, when I see the students not coming to class or not doing certain things, I'm like, what is going on? But
it's not you.
Some people, it's not me. Well, maybe it is, because sometimes it could be, but it could be just they're not really feeling it. But I love the fact that you're sharing that, and I do appreciate that. And I'm sure that there's going to be I hope so, there's some listeners that will be intrigued and reach out to you, because you share a lot of your experience because you are a blogger, which is so awesome. So how did you transition into that? Did you do that before you left dental hygiene, or did you decide to do it once you've entered medical school?
I decided to do it once I entered medical school, because I knew that my entry into medicine was very non-traditional. And I knew that I could relate to people who were like pre-med students, and also people who wanted to go into dental hygiene. So I just wanted to like impart my knowledge and give advice to anybody who was interested in like also just like this representation, because I do have people that I have people that will send me an email and just say like, oh my gosh, like I wanted to reach out to people, but I never find anyone that seems like open to sharing like information with me. Can you help me find a hygiene school? Or how did you get into med school? Like, what is your advice? So I email people and I write them on Instagram. So I really love my platform because it's like an outlet for me too, because it gives me like something to look forward to after studying. I'm like, oh, let me like go on Instagram. Let me post this funny picture. Or let me see what's going on, or like what someone commented on my picture. And it makes my day a lot of the time. So I really like having that outlet to express myself. And I figured, why not?
Right.
A better time than now, basically.
Absolutely. You know, I started my first blog when I had my second daughter. Oh. And it kept me busy. Like, it kept me occupied. Not my second blog, my first blog. Because I've always journaled. Okay. But I wanted to talk about cloth diapering. I wanted to talk about being a mom and share some of the things that we were doing. I was like one of those moms that found like every free thing to do in the state of Maryland. I was making food. I wanted to talk about my natural hair. So I loved it. And I did it for a while. So I definitely recommend, if anyone's looking for a creative outlet, that you don't need anyone's permission to actually publish. Create your own, just create your own. And I can't wait until I'm out of school. Right now I'm doing my master's degree, and I want to get back to writing, because I was writing in the blog once a month.
Oh, wow.
And I'm still doing newsletters, but it's still like, not today. Yeah. This is my last semester. So once that's done, I'll have an opportunity to be able to start writing again.
Oh, great.
I can't wait. I cannot wait.
So currently you're also teaching a course in dental hygiene?
Yeah, so I teach part-time at a community college 1 day a week. Last semester it was like 2 to 3 days, but this semester I said I'm not going to work that much because my GPA was affected last semester.
Oh, okay.
So I won't be graduating with a 4.0.
That's okay.
It's not. I had A's until last semester.
Oh my God.
And it's not like I got an A minus, okay?
Oh my God.
But I'm mad about that. I'm mad about that. But anywho, so I do that. I'm also working as an educational consultant for an HIV program. So I get a chance to actually work in an interprofessional program where we're educating med students, dental students, pharmacy, nursing, dental hygiene, social work, law. They all come together to learn about how to address the HIV, HCV epidemic. And then they just expanded that. So now I get to go in the community also and educate those at risk or who are living with HIV.
Oh, that's pretty interesting.
And then I have Beyond the Prophy, which is what I'm sharing content, trying to inspire people to have career satisfaction. And I host events and I speak. And so that's everything I'm doing.
Wow, you're amazing.
Yeah. Oh, thank you. So are you.
Thank you.
It is a lot. It's definitely a lot, but I have come to terms with the fact that my personality is one not to sit around. I feel like I would be like miserable.
Oh, okay.
If I didn't have multiple things going on. But it is also a hard thing and challenging thing to deal with. Because sometimes you don't know when to stop. You don't know when to pump the brakes.
Yeah.
I don't know. I don't know if you felt that way, but at med school is probably making you have no choice but to get it. Otherwise you won't make it.
Yeah. And sometimes I do feel like I like there's times when I go on my like my YouTube channel and I'm like figuring out ways like what should be my next video, and I'm trying to put like content together, and it's like 3 hours later and I'm like, I should have been reading my physiology book. But I sometimes I get like really wrapped like caught up, and I'm like, okay, like it's fun, but I need to go back to my studies. So
Yeah.
I can see how you can not find that like boundary where you're just like, okay, let's like break a little bit.
I would spend an entire day editing episodes.
Same.
Editing episodes. I said, no. I'm not doing this no more. Like, because then I don't have any time to create content. I don't have any time. It's taking from my family too. Yeah. So, you know, I'm like, I can't. So I totally get it. So what advice would you give, you know, for because there's going to be dental professionals listening, mm-hmm. for those who are interested in blogging? Like what are your top 3 tips for someone that's interested in blogging?
Okay. Okay. So I currently blog on Instagram. I don't have a separate blog at the moment. I know some people do start there, but I would say just the first tip is to pick a platform that you want to start off with. Like if it's Instagram or if it's like WordPress or whatever blogging forum you choose to do, pick that. And then 2, I would say, pick an interesting name for your blog. My name is Madam Winnell online, and that took me a couple of months of brainstorming because I didn't want it to just be like a medical related thing, because I wanted it to still be, you know, true to me and encompassing everything else.
Yes.
But 3, I would say to just create a content calendar, like a brief thing of like what you would want to share. Definitely like make your first post, like don't post it yet, but just like create your first post, and that's going to be like your first intro to the world. And that post has to like grab people in and make people see like why they want to follow you and why you're just show your passion in that first post, and that will definitely like draw people in.
Yeah. Yeah, definitely. You're a lot more organized than I am.
It sounds very organized, but really it's like it's like little pieces like on my phone, like in notes. That's my accountant calendar. It's not an actual calendar. It's just like Thursday, do this.
Yeah, I would just say, you know, whatever moves you, right? You know, but seriously, in order to keep your people engaged or listening, you have to create a content calendar. Mm-hmm. You have to be consistently putting out the information. Definitely. Yeah. I've seen that, and I've seen how it's also helped with people listening to the podcast as well. But there's times where I've actually had to let it go for weeks just to get a break also, you know? So I think the next question I want to ask you is, once you graduate from med school, do you have any plans on where you're going to be focusing? Like, what's your specialty going to be? Because you have a unique background that you could really help the hygiene world at some point when you graduate.
Okay, so right now I'm actually like a little torn between 2 specialties, but I think because I'm a little crazy, I think that I can like mix them together. So I want to do family medicine because it encompasses everything, and I'm used to working in a family practice because my old practice was a family dental practice. Mm-hmm. And being a family practice doctor, you're going to see kids, you're going to see infants to older people, and you're going to treat like everything. You're going to do derm, you're going to see, you know, asthma, you're going to see like a host of different diseases that that will be like in your office every day. So I don't want to like limit myself to one specialty, but I am very interested in surgery. And I know they usually don't go together, but I know that in like rural areas or certain areas where there's not a lot of physicians, you can get some like, I guess it's like a hospital affiliation if you do a certain number of hours during your residency training. So I would like to do like some type of hands-on surgery, even if it's not like here. I know I would probably do it like abroad, and I like the hands-on aspect. Like even now, I like miss like cleaning calculus. Like I miss perio patients, and I just miss that hands-on aspect. But I do some dissections in like anatomy lab and stuff like that. But I know that I still want that hands-on approach somehow in my office. So I just like that family medicine encompasses everything. And so there's really nothing that you could like exclude from your practice, because you're trained to treat like anything, any disease. Obviously, if there's like an emergency, like you should be trained, but that would go to like an emergency doctor. But you're trained to treat just about anything. And what you said about dental hygiene or just dentistry in general, because I have that background, I'm sure that I could like foster this like connection between dentistry and the medical world, because I was already trying to do that as a dental hygienist, but I knew that it wouldn't really go that far, because I was dental hygienist, and unfortunately, it seems like there's like two different worlds. There's like dentistry and medicine, and unfortunately they're not really like intertwined that much. So I know that I could bring that extra benefit to my practice.
So they talked at all about oral health so far?
We just finished the head and neck chapter, but it wasn't. It was just like, okay, there's the tongue, and they didn't talk about the teeth at all.
Wow.
Besides the parotid duct opening on the second molar, they did just the opening of the parotid duct, but like nothing about like taking care of your teeth or stuff like that.
Wow. So what advice would you give for a hygienist that's interesting? What is the one thing you wish you knew before transitioning into this this journey right now? Is there anything that you would have changed or done differently, or something that you would advise someone that's interested in transitioning?
Let's see. I think honestly, I probably would have like shadowed more dentists. That sounds kind of weird, because like I did enter dental hygiene school, and I was at NYU, and it's a dental school, and we have clinic alongside the dental students, but I never really saw that much of what they were learning or doing. And it never really like crossed my mind that a dentist would be doing certain procedures. I don't know. I just never saw like the bigger picture of being a dentist. And I think I probably would have known sooner that like I probably wouldn't have wanted to become a dentist. And I was already a hygienist, but it took me like working for about like 2 years or so to realize that becoming a dentist just wasn't something that I actually wanted to do. But I really love hygiene, so I think I would have just shadowed more dentists and spoke to more dentists, and maybe even shadowed some dental hygienists like in the community service field, and just kind of seen what their job was about. But obviously I love learning every day while being a hygienist. But I would have just shadowed more dentists for sure.
Yeah.
So that I would have known like what I didn't want or what I did want sooner. But I mean, I have no regrets for sure. But hygiene definitely brought me to medicine, because if it wasn't for hygiene, I wouldn't have realized that this is what I wanted to do. Because as a hygienist, I was always like that. Like, I was always like, your oral health is connected to your systemic health. Like, your mouth is still attached to your body. And I was like always so passionate about this. And my sister was like, do you want to like be a speaker and like convince people? Like, and I'm like, yeah, because that was like my thing. Like, I was always like preaching this, like, your mouth is attached to the rest of your body. And I had did some research at NYU with periodontal disease and diabetes, and trying to see if we could use the blood from the gingiva, from the crevice, from the clavicular blood, as a screening method for diabetes in the dental office. So once I did that, I was really just like telling all of my patients, like, did you know that there's a correlation? It doesn't cause it, but there's a correlation. And I was just really, really amped on reading a lot of those like research studies that would show the correlation between oral health and overall and systemic health. So definitely dental hygiene brought me to medicine. Like, I don't think I would have realized that had I not become a dental hygienist. But I would definitely say whatever career that you want to do, I would say speak to people in that profession, shadow them, see it for yourself, like see it, enough times. Like, you don't have to do it every day, obviously, but just like speak to a couple of different people. Like, don't just speak to one person that tells you one thing, because everyone's experience is different, and then you can make an informed decision and then go from there. And, yeah.
So, what I'm hearing from you is really doing an honest and deep self-reflection on your why and what you really want.
Yes.
What you really want, and be okay with making that decision and going for it and taking action. Nothing you've said so far in this interview has showed that you held back from pursuing your goals. And I think that's what's very inspiring about what you're doing, and the fact that you're, pushing through and having a good time while you're doing it. Because I know it's hard. I'm sure it's hard. It's hard. All right. So here are my final two questions. Last one. My first question is, what was the last book that you read? Besides a medical textbook.
Okay. That I completed, or that
you could have read maybe a couple of pages.
Okay. Well, the last book that I read and that I'm currently still reading is actually a book called Como Agua para Chocolate, and it's a book. It's a book from like Mexican literature. It's pretty famous amongst like Mexican literature, and I'm reading that book because I'm also learning Spanish right now.
Oh wow.
So I watched the movie, but now I'm reading the book. So
very cool. Very cool. I am all business personal development, but someone just posted that Gabrielle Union's autobiography was extremely good. So I may pick that up. I don't know. That's like venturing off into another side that I typically don't read about. But I love the fact that you're enhancing your language and the culture. I love that. Okay, final question. What was the best career advice you've ever been given?
I would say the best career advice, well, I don't know if it's actually career advice, but it's more of like when I was having some doubts about medical school and if I could like make it through and stuff like that. But I had a mentor tell me to read my personal statement again, and read that personal statement and put yourself back into the shoes that you were when you sent your application, and just like channel that passion and remember why you wanted to do it. And it was just like, the person that does it will do it. So don't worry about who's doing it and who may be doing it better or making it look easier. Just know that the person who actually does it and just applies themselves will complete what they have to do. And I actually did read my personal statement, and I was so passionate in it. And I know that there's nothing that I can't accomplish without without channeling my passion. So if I'm passionate about something, like I will accomplish it. So I always remember that, even if there's like some test that I know is like so hard and, I don't think I'll pass or do well. I'm just like, no, I know why I'm here. Like I fought to be here and I will get through this. So that was really good advice about just like channeling your passion and just remembering why you're doing it in the first place.
That is awesome. That is awesome. Thank you so much for sharing. And, if I still have this podcast in 3 years, knowing me, I'll be doing something else. But if I still have, I would love to interview you again. Like once you get into practice.
Thank you.
And really, getting out there and seeing what it's like, and then get like a comparison, that would be so awesome.
I would love to do that. It would be a pleasure. Thank you.
Well, thanks again for coming on. Let the listeners know where they can contact you or where they can find you.
So you can find me on Instagram at Madam Winnell. Should I spell it?
No, we'll put it in the show notes.
Okay. Sorry. So you can find me on Instagram at Madam Winnell, and you can also find me on YouTube at Madam Winnell. And make sure you stop by both of my pages and let me know what you think, guys.
All right, sounds good. Well, thanks again for being on the show.
Thank you. Thanks for having me.
No problem.